This morning, we will talk to the Minister of Health, Wena Dr. Austin Demby, as he can talk about the National Health Summit. Good morning, once more. Welcome to Radio Democracy, sir.
Good morning, Usman. Good morning to all you listeners and viewers.
All right. Before we can look at key among way in the Mpox and the summit, firstly, waiting on the happen at the ministry.
Well, a lot not going on at the ministry. In fact, now make we try to convene this health summit. Say about 4 years ago, we started on a journey for say we need for completely overhaul the healthcare delivery system of this country. Fostering healthcare now disease-based. Again, malaria program, TB program, HIV program. So again, you get a very good malaria program, so when they get typhoid, you're able to manage them. You get a good typhoid program, so when they get malnutrition, you're able to manage them. So we don't shift focus now. Instead of you look at individual disease, you look at the person. We look at person-centered care, human-centered care, and for those, make sure say everybody get involved, and ensure say we get universal health coverage with the follow life stages, from the mommy, from the pregnant woman, till to the pekin, till to you go school, till na adolescent, till na adult, till na senior citizen. Each of them, they require health needs, and we direct this health needs towards them. So we need to shift that kind of dynamics there in healthcare delivery. A major effort, not a free tongue issue no more, at the whole country. So what we've been doing the last 2 years ago now for bring everybody together. So Lord all can see them. Lord look at this new kind of way for deliver health service. So now been the first summit that. So between attending now and now, we don't register some phenomenal gains. Dramatic drop in maternal mortality. Dramatic drop in infant mortality. You see vaccination coverage for 5 years in a row. UNICEF gives you some award 5 years in a row, the best in the continent. We score over 95%. And at the same time, we don't introduce new vaccine then, including the malaria vaccine, including the Mpox vaccines, including COVID vaccine, all new vaccine with the same kind of health workforce. And we don't move and go to a completely different level. At the same time, we don't train more doctors, more specialists then. First of all, we train about 20 doctors a year. Now they go to about 200, one up about 250 to 300 a year. Right now we don't train about close to 40 specialists then in gynecology, in OBGYN, in surgery, in all different disciplines. We don't open new medical school in Jala, way for complement commerce. We don't open new institution, new hospital now. Jojoima, we don't open the Julius Malabio Center of Excellence. So all the incidents they go on. Now time for we come back and say over the past 2 years, which we don't do right, which we not do so well about, which we for change, which we for adjust, which we for double down on, which we for drop. So this is an important summit, not for health workman no more, not for everybody. Civil society, development partners, paramount traditional leaders, all cadres within the healthcare system. They're all in different districts that all they can convene in a residential summit. Such that the go person need to go tap na Calvato, go tap na Waterloo, they can meeting, all the can day on campus. We get meeting 24/7 from morning, from breakfast, all the way to lunch, all the way to breaks. You interact with your colleague district medical officer then, colleague lab people then, colleague administrators, for see how we will for develop healthcare system to the next level. Now that is summit there about.
Okay, we can look at the summit proper, but what's the status of the malaria presently in a salon?
Malaria is still remain the #1 killer in this country. And I think say for we, the focus now, seem like malaria, we get concerted effort. Again, we not look as malaria no more in general. We see how malaria they affect pregnant women and direct intervention at them. How malaria they affect picking them with direct intervention. How they affect adolescents, adults, and senior citizens. Right now, we get about 5 million insecticide-treated mosquito nets for a population of about 8.5 million people. Yeah, we get a new vaccine, what they use for picking them especially. We get good treatment, we get good diagnosis. Now, what we need for do now for direct all the asset then they to who say they get the biggest impact. So in the past, just we get nets, Lord, just distribute that. No, we don't do that now. We make sure say, who say the malaria case then they come out? Other it they affect, and then we direct their asset their resources to them. And we don't only do that, we dey track them, we dey monitor them. If we get their assets here in the right place, waiting at the delta, waiting at the change, and we dey monitor. If we change really good, we dey double down on that. If the change not right, we dey go back and go look at the data and say which will they miss. A few weeks ago we named Moyamba. We see say Moyamba 1/3 of all of the mortality than malaria. So the number one thing we ask now, who do they get this malaria? Na pikin them, na mommy them, na teenager them. Who side them they? Na riverine area, na the big city them, na suburban area them. Then if you don't know that really well, then the asset we get now, you need to go distribute mosquito net all side no more. You dey focus on that side, they forget the biggest impact. So now that we do in the country.
Okay, still on the updates, this BNT, the ministry will launch the National Health Train campaign, and how far with that campaign there, and which impacts on the rates at the different districts where it don't go?
So phenomenal campaign. So we try and force a month, then we go Moyamba. Within the health campaign they do now for Guna, the whole district, all aspects of the district, find out how healthcare they get delivered. We they ask the workman them, the health workman them, we they ask the community within the staff, we ask civil society, we are speaking them. We look for see waiting and getting at the hospital there, waiting and getting at the CHC, waiting and getting at the staff company, waiting and getting at the supply chain. Always thing you need for you make that the work go before. We find some very, very interesting results. First them say, let's send more doctor and go Moyamba Hospital. They need the doctor. We go now Moyamba Hospital, not to just any hospital. This Moyamba Hospital, it gets oral health, they get dentistry chair there, then get nutrition unit, then get mental health unit, then get all what you need. But the hospital utilization about 30%. So you get 70% excess capacity. So they solve that by bringing more doctors and bringing more nurses. We go into the community and say, why make one another use this one a good hospital? What you need for do differently? For long I use this hospital also. Again, so now that kind of discovery they do they get things like malnutrition or find boku malnourished picking and day. Well, you can treat the malnutrition, but we can go upstream of that and see how from the mama them will they begin train them how for able to get nutritious diet for you picking them, how for manage the picking take, so we go prevent the malnutrition before we treat them. The same thing with HIV. We see about 1.8% HIV prevalence day, and mostly now they picking them and they get infected. They begin to die before age 5. Well, you get an opportunity not to for only treat the picking right, identify and treat them. You go to the mama and ensure say we identify the mama then early, test them. If they're positive, we treat them. When you treat the mama, it's good for the mama in health. At the same time, it prevents transmission of this virus to the picking. So then kind discovery. Now they see we not go do that by sit down at you building.
Okay.
We go now district by district for go find out what they go on so we can overhaul the system. And what's happen now? We they challenge the team now on the ground. We they set targets. For example, if your malaria rate at 30%, we they say what we need for do with you now for reduce this from 30 to 15 to 10 to 5 to 0 preventable deaths.
So Dr. Demby, is it true that plenty more mortality rates really happen on malaria sick?
Yes. That has been the case all along.
Okay.
As you know, say salon, what you make them call salon, then which man people in can call on the white man's grave, and because of malaria. So the first big malaria research center, now the whole of Africa, now yeah, been there. The reason we make them create hill station, now because they say mosquito now they go up the hill, so that make the rich man and go tap there. But malaria now big problem, yeah. But we will go able to solve that problem there with the new tools that we don't get. Now how for adequately deploy them tool and monitor and track them. Now that's what they do.
All right. Concern this BNTM around social media and other platform them get for do with the Kenema Government Hospital. you see video.
Yes,
You see that video they saw?
Yes. Again,
Is it not the status of the hospital there?
that is so false. That's so patently false. So what's going to happen in this country? I know all men are journalists now. You get this small camera, you go point any side. This now abandoned building on the outskirts of the hospital. So right now we focus on building the hospital safe. As you know, we don't establish solar power at the one whole hospital right now. Not only that, about 18 hospitals in the country, and we don't provide solar solution into them. With the video you see na Kenema, an abandoned building. So what would you do now? In fact, we just say, okay, well, Lord, just bring this thing back to life, fix them, renovate them, and utilize that again. But not to side with them they used before in an abandoned building. You can get the same thing na Bo Hospital, where the woman and king and they done before na the intensive care unit for them picking them. Historical thing. Right now we don't build beautiful dormitory with about 10 suites and about a clear waiting area for them picking them. But still you see people and they circulate the video from historical past around Bo Hospital. So things they change, things they really change, and perhaps we have not do as good a job for tell people them, but then changes here where they occur. So I've been very shocked and surprised with the Kenema incident. We vexed, we call it, and I said, no, this is an abandoned building. We just said go inspector, it's an abandoned building. But again, with the turn down it because it didn't have the hospital premises, we did convert it into a very, very useful facility.
All right, before we go for break, waiting so far don't they happen with the hospital in Lumley, the 100-bed, not the one for the picking there or the general one.
Yes. So I think we don't begin this conversation before. Now 3 of them the one at Lumley, the one at Waterloo, and the one at Macaulay Street. This now being Kuwaiti funded project. The Kuwaiti funding get contract with local contractors for delivery service. And we get difficulty with the payment process around them, and we don't resolve that problem there. But now a relationship between the Kuwaiti and the contractor, we want to insert ourselves into it and say, no, Lord, just go ahead and pay for them. It will cost about $1 million for each of the hospitals there for complete and make them functional. We want let that happen. But now contractual arrangement between Kuwaiti and the vendor. So until we talk to the vendor, say if we advance them, let it finish the thing, then we Kuwaiti then pay them, let them reimburse government. I think that way that need for go, but it's very delicate. You get to trust people around that. So
any progress done there from the Tewi Komoya?
Yes. I think so. They work with Ministry of Finance. Then they actively work. Look, if that hospital they done today, me go be the happiest person around. Because you see, say the Lumley crowd don't grow. I mean, we don't go from a few thousand to close to 1 million in that part of the country. They need services. Now this new hospital will build a specialist hospital, now picking them when are the sickest of the sick. Now everybody they carry them picking them good, but they're not going to overwhelm the system very quickly. So we want let this big hospital come, let it be functional, so it will be able to offload the pressure on the Center of Excellence. So we work on that very seriously, and I hope say the next time I come, and I'm going to explain again. I will tell them I said the hospital local.
The program Good Morning Salon continues still inside the studios. We get Dr. Austin Demby. They talk about the National Health Summit and other issues. And we will bring the program to you this morning. My name is Usman Kamara.
And Mina Kaifa to Conte. We still get the Minister of Health, Dr. Austin Demby, where they also for talk about the National Health Summit and other things we don't happen at the ministry. So, Dr. Demby, before we come now to the National Health Summit, what's the current status of Mpox sickness alone?
So, Mpox, it don't really get very serious. We start with about only 2 cases na Freetown, so in the middle of January. So in about 4.5 months, we don't go from 2 cases to nearly 2,000 cases. So nearly 1,500, 1,600 of them cases in a Freetown yard, especially Western urban and Western rural. A serious case, about 11 people and none die. from this year. So mostly people where they die now, people where get other underlying sickness where they make the Mpox much more serious. But this Mpox here, now, you know, if you catch pussy, you get fever, small fever, you eat the out, you back the out, you get tired. But the most important thing now, crocodile they come up on you. You know, the crocodile they come on your face, on your hand, on your body, all over. You know. The crocodile itself, in about 2 or 3 weeks, it will able well by itself if you're able for just keep the place clean and tidy and dry. But in a lot of cases, you get secondary bacterial infection of the crocodile where they make the thing explode, they make it really bad, it get extremely painful. We tell God thank you. Right now, the fatality now less than 1%, about 0.5%. But even now, the 1% in life is very important to it. This sick here, what you been do first time, we person come important. If you get any crocodile in your face, not try for diagnose yourself. Go to the hospital, Lord, test them, Lord, make sure it's an Mpox. And if you know it's an Mpox, what you're going to do, we give people a medicine, we'll get a diagnosis, we send them go home. We tell them, say, for take care of themselves, let them make sure, say, other people do not get infected. But we don't find out, say, as we send people at home, they're not able for contain the sick with themselves. You know, every time somebody go back home, any 2 3 days, they get more people than they come off from that area. So they be say the community transmission is extremely high. Now I mean we see that kind of number. So the not a good thing. The team will also recognize now this Mpox is recognizable. You go see them. As you see them, the main way for transmit this Mpox now intimate body contact. If you get close to the pussy, you touch the pussy, you touch the crocodile, or the crocodile attack camper you. Now that way you get them. But if you're able to keep you distance from people there, or if you see somebody with a crocodile pana in place, not about discriminate against them, you instead not ask for the crocodile or the sick. Okay. Now for figure out a way like you go able for get in hospital that we able for men. And the best way for do now for wash your hand, because this hand are the biggest transmitter. If they touch all things and they carry the germs go all side. So follow the wash your hand frequently. Also you go with soap and water. If you're able to get hand sanitizer, you wash your hand, you're able to keep your distance and make sure say anybody will get crocodile, you stay away from we'll be able to contain this here. So this the main partner upon this help. The hospital would already that will get diagnostic testing. We get people that will know how to mend this sick here, so good one. But this sick here will not go able to do all things in the hospital.
Okay.
Now the community that we all get together for identify the cases so and able for manager. So the big shift where they can now, where we go from level 1 to level 2, because now the whole country don't get the infection. Every district don't report. Now we know how to send people and go home again. One, if somebody get infected, we bring a kind of facility where we're able for mend the sick for himself, so you go get better quicker. You know, getting secondary bacterial infection. At the same time, if we pull and come on a host camp for campaign, we want to go to the host law, make sure so vaccinate everybody in the host, so that you get ring vaccination. We go protect them all, and you know we get transmission. What you get now about 60,000 doses of the vaccine now we get. Right now we don't use half of them, over 30,000 on go. Now very few of the vaccine on left for the number of people that already get. Imagine, as I say, if you pull one case, you get to go vaccinate the whole host as the top priority. So with that kind of shift, they will feel say we're not going to only take care of them people, so we're not going to see them bad picture so of all the body part that we get infected. We will for manage them very well and make sure so that we recover properly. At the same time, we prevent transmission in the community. So
okay.
Now with the shift from just medical reaction to a partnership between the medical facility and the community who they serve.
Okay, so why is it that we dey record plenty case of Mpox na the urban area than the rural community, while outside the sea come out when at the Democratic Republic of Congo, they record more cases in the rural community than the urban?
Well, I think there are more proximity, more density. Okay. Well, yeah, so like I say, the way people in the transmit this here so now by body contact. You know, if people engage so close to each other in this over the environment, then the intimate contact, and the sweat, and they touch each other, the transmission will be much faster. In rural communities, people can get a little bit more space between them. They interact so much, you know. So, and they transmit as fast. But again, the same mode of transmission when they happen in an urban area, then they happen in the rural area. Then, if you're able to touch somebody, we get the chronomo, you get that.
All right. Now, when the Mpox, we start for record cases, a lot of people then get how then they interpret them as way for MENA. Is it true that Pegapack now one of the ways for MENA?
So Pegapack now the drink, the alcohol.
Yes.
I know, you get long make unsubstantiated solution to it. What's for happen, can hospital. Where you can hospital, I think them paper doctor business, you don't know what you deal with. Pegapack get alcohol inside, so obviously it will help small bit for prevent secondary infection. But it better that you can hospital, let them work with you. I think say the paper doctor and a lucky dip. Sometimes you go win, sometimes you don't go win. And you have to be careful that you not get worse. Because if you get worse, for example, what you see that image here now, if you get secondary bacterial infection, you go begin say you begin lose your body parts, you begin lose limb, and it's sometimes irreparable. So it better you can hospital let us see we go manage them, we'll make sure so we'll take good care of you. Right now, we don't get some facility in Calbaton or they open for about 100 beds. We don't get the police training school in Hastings. They don't give you about 400 beds facility. We'll try to make that and get it ready. At the same time, we get an infectious disease hospital now Port Loco. We use this now for opening set now 100 beds. So between the 400 bed na Hastings, 100 bed na Calbaton, 100 bed na Port Loco, and all of the hospital them they get isolation unit them. I think so we'll begin extract people and take care of them. One of the things that we really want to be careful about is we don't want to overwhelm the hospital system. Because right now, as all the talk, so you get about 1,586 active cases them. If we bring in all kind of the hospital them, people they not go and go to hospital now for the regular thing them. So all they talk is now how much people in the die of malaria, how much people in the die of typhoid, how much people in the die of all the different we don't try to get a good handle on. So what you want to make sure so we not lost the services in there. Now I make what they say, we'll take them people that will carry them go somewhere, or we'll take good care of them. Okay. At the same time we allow services, routine hospital services that will go before.
Alright, another way of for ladies sick transfer to person, people don't they allege saying through mommy and daddy business.
Yes. So again, we get very strong evidence say mommy and daddy business will be a way of transmitting a virus, especially for one different clade, one different type of the virus. But what's going to happen? Elect na mommy and daddy business, elect not to mommy and daddy business. If you get crocro, you get intimate physical body contact, you could transmit the virus that way. If you get the crocro and the scab, the thing for on the bed, the woman said to sleep in the same bed, you go transmit the virus that way. So again, let me not put too much premium on the mommy and daddy business. Again, if we focus on the body contact, the more clear way of transmission, we go on the right track. But I don't say all the man and don't begin scared for smart man. But again, I think say together we go work on this. A lot of focus on the body contact. A lot of focus on say if you get the pustule, if you get the crocro, now they the virus day.
Okay.
Yeah.
Alright. Quickly, before go for break, the Jewish hospital, we can call the Chinese hospital. Now another hospital where they take care of the Mpox.
Yes. So right now, 34 Joy. In fact, all the hospitals in the country they get small isolation unit then within the use. But like I said, now the number now the Western area don't high pass mark. And I make we really want to see if we're able to move them into a different facility.
Alright, as you there for clarifying something them and for make you aware of something them. Rumor around now that the patients them inside the hospital they can come on do for campaign food. You are aware of that? That's not the allegation.
Well, again, we dey try. So one of the big things that we dey talk about, if I will say we dey get 400 beds na Hastings and 100 bed na Calvert. We dey say bed, not to the bed no more.
Okay.
Now, all of the services that we do around the patient, so it include the drugs, include the clinical care, include services, include food as well. So, maybe that not be historical issue, but as we go forward, we make sure say the people, if you say the common you host local menus on site, you get an obligation for provide food for them.
Okay.
So right now, as you know, the government don't try. The government don't give about $1.6 million for able for quickly respond to this. Right now, the WHO and Africa CDC people over come and say you need about $7.5 million for contain what you get now. If we not do the investment now, you wait say 2 or 3 weeks, it'll cost nearly $20 million.
Okay.
So right now, what you do, the small money where the government don't put forward, now seed money all they try for utilize quickly for able for block this. Me know that work what they do now bigger work. And they go around for work with people and so like with the first vaccine we then give the vaccine not there for buy. Yeah. Certain country they don't buy the vaccine and don't keep them for the young people them. So big thing and Gavi, Ireland they send some for we. Right now with the big UAE, with the big different countries, they let us make it available because even if we're getting money, they for buy.
Okay.
So I think say this we don't go through Ebola, we don't conquer Ebola, we don't go through COVID. This is safe, yeah, so we'll be able to conquer, but we need cooperation from the community and everybody business.
The program Good Morning Salon they continue and we still get the Minister of Health, Dr. Austin Demby, where they also for talk about the National Health Summit and serve different things where don't they happen at the ministry. So Dr. Demby, take me through the National Health Summit where the ministry they plan for all now in the country.
So we're very, very pleased for we launch this National Health Summit. It is start on Thursday. Thursday the 15th, His Excellency the President said don't consent for come launch this summit. So on Thursday we begin get major deliberations around how the different sectors and the different aspects of we work they go before. The discussion they go on till Friday. Friday at the end of Friday will they begin chat out what you will need for do now over the next 5 years. Which kind of major focus area that we need for investing. On Saturday, with a wrap up with an aid memoir where they say over the next 5 years, now we all agree for do. And what you they do with the aid memoir, we the health workman and with the sign them, saying I so don't agree, with development partner and they sign them, the people who they serve then go be witness to them. In the evening of Saturday, one get small get up for tell the people in Tenki. All them workman and where they work now, remote side where they work, difficult terrain them. We don't really excel in them work them over the past few years. We want to acknowledge them. So we get a very big award ceremony. I mean, somebody come to mind, Omande, na remote place, na Koinadugu, we deliver 4 picking them, quads, and the picking them healthy and strong. People are new, they deliver 5 picking them. People are new, they work in remote area, and we not see them every day, but they work meaningful to we. People and they wait and say for Marklet and then they go by boat, by river, by all sides for carry Marklets go to people. So again we get an opportunity for can tell them thank you for what they do. So we ask the Vice President for can help with the closing part on Saturday.
Okay.
We hope say at the end of this you get a really invigorated Ministry of Health where they go out there for deliver services to people there.
So how these summits they aim for address the current health challenge in the country?
What's one the Mpox?
The Mpox and self we get to do with maternal, child health and plenty other ones.
So again, as I say, now 2.5 days of discussions. For each of the day they will figure out what thing we need for do differently for all them below man for able for reduce the maternal mortality to 0 preventable maternal deaths. we dey also decide say for them picking them, wetin we need for do as the ministry for get zero preventable infant death. We do the same thing for market them, how they make sure so we get zero vaccine preventable deaths. So we look at every aspect of the work, from primary health care to secondary and tertiary care. We look at health security. We look at ambulance services. We look at maintenance. We look at supply chain. We look at staffing and staffing complements. We look at customer service, how the people in the field with the service they're with the give. So again, we address all the issues in a very systematic way. The good thing about them also, no only it just be say talk no more. With the set targets. With the set targets will all they work towards, and as how would they monitor the target, then they see if we make advances or not. By the way, we don't set up a new emergency operations center now. Actually in New England Villa, we get a bird's eye view of all of the district them in real time. So, for example, right now we get about 30 maternal deaths a month. We don't count on from 200 deaths a month to 30.
That's not the whole of our country.
The whole country. So now we say what you need for do for reduce them to 5, to 3, to 2, to 1, to 0. We go district by district. So from Yaso, from New England Villa, we watch and see what's happening in every district. And then say if you get pregnancy and you're in a difficult pregnancy there, we go there in advance. Say what you need for do for help you for ensure so in difficult pregnancy you land them safely. So again, I don't know, there's beaucoup other countries they can watch for see what in Salon they do. This is now very, very revolutionary, strategic, tectonic shift in healthcare delivery now. And I think say now you all get for be proud of, and we know they see the result right away, but they begin see them change there. So the change all they see now systemic change them. Not so just quick change, systemic change them. We're not able to see the result there. That's how they go.
All right, Mr. Minister, we'll get a lot of messages them inside the program for you.
I hope not goodwill messages.
Yes, and I hope and we know say you go left we at the studio at any time from now, but we want to take some of them messages there. This one say from Edmond Lavalle, say good morning 98.1. For clarity's sake, can the minister please tell us the difference between chickenpox and Mpox? Most people are perceiving this Mpox to be chickenpox because symptoms are the same.
Okay, so chickenpox now completely different virus. It belongs to the herpes virus group. Yeah, chickenpox it mostly affect Pekin no more. Chickenpox now through aerial pathway airborne transmission it occur. And as I say, the epidemiology of now picking them really it catch. And chickenpox it can catch older people then, but what's happening first now picking it catch, then later on the virus it can slip till then we don't old about 60, 70, it can bust back by you in a different form. But again now completely different virus, now herpes virus, there a herpes simplex virus, now that group they belong to. The Mpox now completely different family of viruses. Now the Mpox virus, now in causing a smallpox, yeah. But in a different virus, the mode of transmission is very, very different. The way they affect people is very different. You know, they able to focus on picking and no more. It infect all man. The mode of transmission also very different because now intense body contact now they make it get transmitted, and you get sexually transmitted as well. So now completely different virus then. Although the symptom there can look fever small bit because now crow. The thing with these chickenpox, now picking they affect the crow, the small, it is spread over quickly. For Mpox, the crow them big, you know, and then they start now the face, now the hand, and instead they spread. But when you see them, much more deadly looking than the chickenpox, but a completely different virus. Then.
All right, another one very important from positive mindset is a good morning, Radio Democracy. It is disheartening to know that even the vaccines that the health minister said the health workers are top priorities, as it stands now, the vaccines is not available for even the health workers. Few days ago, my younger sister is a health practitioner at one of the hospital in Makeni. I asked her to take the vaccine. After a long conversation, she finally accepted, but when she went to take the vaccine, she was told that the vaccine has finished. Please ask the minister if he is monitoring the vaccine distribution process. A comment from Ahmed base in Turkey.
Okay, still on the vaccine. This one again from JB, our Facebook page. They say, ask the minister which category of people are eligible to take the limited Mpox vaccine that is available now, because there are rumors going around that some health care workers are selling the vaccine because it is relatively scarce. How true is this?
Okay, so just first, them vaccine. Oh, English or Creole? We'll get Creole. The vaccine, they for buy. Even if one buy some side. Now, one great manufacturer, they manufacture the vaccine, and India then they, available. So the stocks that we did, all in country, the NBB country, buy all of the vaccine and they keep them for themselves. So not only big with a big them for let they able for release some of the vaccine into it. So this BNTM we go big Gavi, the Vaccine Alliance, they able for give about 53,000 doses. Then Ireland, they said give it small, Africa CDC then give it small. We add all to it's all about 63,000 doses. So there's 63,000 doses here. What you would try to do first now for say, then frontline healthcare worker them. We very likely say then go see Mpox case, then go manage, then go near Mpox case. Let me protect them first. So we number one priority then for give frontline healthcare workers. Number two, if you get Mpox inside a household, importantly we'll vaccinate the people around the household. The number three priority now people that we vulnerable, like people that we immunocompromised, where they get other sick that we make the immune system not strong. We want to prioritize them. So the limited vaccine that we'll get, we'll not give all man. We want for rational for them people. So right now, all we can they try to get more vaccine for coming. The UAE, the non-promise that will give you about 20,000 vaccine. As the vaccine come, now so we will expand in use. But right now, the one then with the healthcare worker that went on the front line that they will give first. First of all, they give the thing people they say they don't want, and they then call the block. First take the vaccine now. It's available, and if we run out now the district, then we will begin resupply them fairly quickly with which you will get. But again, if we use all of the remaining 30,000 doses, then we're not getting nothing again.
Okay.
And the way the infection, the rise, as I don't know how I explained that before, we don't get 3 waves of the infection. The first wave now being 2-3 cases the normal they see. Then January 10. By then February, March, we'll begin see a second wave where they begin get 50, 60 cases. Now we're there in the third wave, where yesterday we report 165 cases.
Per day?
One day. So we did in a really high trajectory where if we're not able for stopper now, if we not do everything for stopper now, we'll go begin get 1,000 a case a day. So now make it really urgent now. The small vaccine we get for full sense for utilize the vaccine. But again, the main thing now, the community get for joining for identify the people here. Let we pull them, we can mend suffer one and prevent the transmission.
All right, 2 things, Mr. Minister. Is it that when you take the vaccine, you not go get the Mpox?
So the way we vaccine and they work, the way the vaccine, not to this Mpox no more, all vaccine and the way they work, they prime the system, they prime the body. Yeah. But very, very few medicine they for virus them. But when you use the vaccine they prime the body, where you not get the infection yet. They yak the body. You give them this fake or weak form of the virus or kill form of the virus, you work so that the body they know what it look like. So they tell you to get the actual infection and the body don't know. Normally it will take you 2 weeks. If not new infection, the body not see 1 day. It will take about 2 weeks before the body reacts. But now that you don't get the maculates, as soon as the new virus can, the body don't know I want them. The body they mount an aggressive response. We're going for container. So the vaccine, they say you go get infected at all. It means that if you get infected, it will make sure so you get a mild illness. The way for Preventive, now wash your hand, use hand sanitizer, social distance. Let we prevent the infection in the first place. The vaccine, additional tool for just help you. Just in case you get infected, let me make sure say the infection no be too serious.
All right. Somebody send message now. We 077981981 inbox away from the denting the audio talk. He said the head of NEMS was suspended without warning. What's your position and what are the plans for reinstating him?
Again, NEMS are the number one ambulance service in this country. The ambulance service. Now the symbol of the health system. Nobody they call ambulance we're not a serious thing. So the ambulance responsibility now for respond quickly, for take people them and care and go for immediate care. If we not get the service where they able for address that and it be seen a governance and management issue, the responsibility now for change that.
Okay.
So they get an ambulance service where you wait for stay with somebody come is sick, they don't got a wound, you say give me money for fuel, or say the ambulance not service it, or give the DSA to the driver for they run a service that way. So we get a situation where the name service be nearly fall apart. So we put together a small team for say let we change and make sure say the referral systems it come back up to speed. Now, first step before December, they get alarm call or crisis. The ambulance driver no day, fuel no day, the ambulance tire boss, the driver go. We don't get any kind of problem in. Now we don't institute changes in the short term. And we want to make sure so we get long-term changes. So we get an interim team where they manage the national ambulance system. Imagine, from December to now, you don't hear any complaint about ambulance then? Very, very minimal. So things that change for the better. Again, internal administrative thing then, but we want to let the people entrust we. All we need for do something for the good of Salon.
Okay.
And then changes the way they do for NEMS and for the good of Salon.
Okay, so Dr. Demby, one key challenge where people on the face now how for make them able for do surgery pass the left salon and go other country where some not can even get the fund for do am. So how this summits the help in the area for make salon get more specialist doctor them?
Yes. So Kaifatu, a really good question, Andy. You asked. As I say, we don't shift. The president announced postgraduate school. So they get 3 different postgraduate schools. One for medicine and surgery, the other one for nursing and midwifery, the one for pharmacy services. Right now we don't begin, as I in my intro, we don't train about 40 specialists in different disciplines. We get a big program here so now where they look at surgery. And not only surgery, we look at imaging as well. As we talk now, so in the next week or two, they land 2 CT scan machines for public use, not for private use. We put one in Connaught, we put one in Kenema. We don't set up the system already. People in the travel mostly for the diagnosis, for the imaging. Now we're able to address that. And hopefully we will spread the CT scan capability throughout the country. Mercy ships where they are and they do surgery them for take off the load from the government small bits. But at the same time, they get a program here where they train Sierra Leonean surgeons. Dr. Kabasa can go do a few surgeries, but then they train the residents per surgery. Not only that, now the training within go a certified through the West African College of Surgeons. This week, that's how we did talk. We get a huge program over the, in fact, I don't know, we go Moza Beach or something, you know, where they meet. We they change the one whole hospital services with surgery now a major component of our work day. The old one going back again now for get trauma network in the country.
Okay.
Starting with emergency hospital, emergency hospital, we do the same thing for Connaught Hospital for really make a good surgical center. We get the same thing at Masanga Hospital. We want to create a network of surgeon and surgery capabilities in the country such that anybody will need trauma surgery get a facility within a 2-hour range. Anybody will need trauma get a stabilization center within a 1-hour range. We create the network throughout the whole country and in our department. And again, like what this cinnamon, a system we create. We will say we create surgical system. We do the infrastructure, we do the imaging, we do the staff training, we do the equipment, we do the post surgical care, the nursing, the anesthesiology, the whole network where you need for get the kind of surgery Salon will be proud of. So I want to watch this space. We're going to watch this space over the next few years. How will they change surgical services in this country? So we will dedicate a big time on this BTR for share the plans and get input from everybody around how we want to transform surgery in the country.
Okay.
And by the way, masterships, they come for 1 year, then extend for another year, they not extend for 1 more year. At the same time, they come for the 5 years of training. They not extend for another 5 years of training, stay 2030. Now, because they get good partner in there, then believe in what they try for do.
For management and staff and democracy, one for which His Excellency the President Julius Maada Bio a happy birthday. We pray that God go continue for guide them and for make ego able for give the strength and self-wisdom for make ego able for do more for Salon people.
And one for tell the pastor who the body. 98.1. The power the kind of office, not kind of office safe, or the kind of host to you. Dr. Demby, and as you said.
The exact same thing. You know, this is one of the most exciting times for we. As a commercial, we're going to the birthday business.
Okay, we'll go send a good on the.
But the president are clear visionary. Yeah. So for me, waiting me really left for the president and somebody where they see the before, they see waiting for. You want they imagine waiting Salon will be like now the health sector by 2030. And if you get that kind of vision, the important thing now which you need for do today for change systems, forget you to say you angle.
Okay.
So we'll tell them boku thank you for give you the opportunity in the health sector for transform the health system, and at the same time we wish them happy birthday.
Alright, plenty thank you for joining inside the program this morning because we understand say you retire for rush to another program. We hope by the time to tell we get you because you don't give you the opportunity always for Canada democracy.